The prospect of experiencing a heart attack while alone is deeply unsettling, yet it's a reality that occurs more often than many realize. Most people assume they'll have time to react, that symptoms will be unmistakable, or that someone will be nearby to help. However, the truth is sobering. The first few minutes of a heart attack are critical, and your immediate actions or inaction can determine whether you survive. The encouraging news is that even if you're alone, you can significantly boost your survival odds by acting swiftly and following a clear plan. In this comprehensive guide, we'll outline 7 crucial, life-saving steps to take if you suspect a heart attack while alone. These steps are simple, require no medical training or special equipment, and are designed to help you stay calm and act decisively. We'll cover how to recognize early warning signs, what to take immediately, how to reduce strain on your heart, and small actions that can buy you critical time until help arrives. Stay with us until the end, as the final steps are often overlooked, but could make all the difference in saving your life. Let's dive in. Step 1. Recognizing the earliest warning signs. The first and most vital step in surviving a heart attack alone is recognizing its symptoms as early as possible. Many people expect a heart attack to feel like the dramatic, crushing chest pain portrayed in movies, but real heart attacks often start with subtler signs that are easy to dismiss. Ignoring these early warnings can be deadly, as acting quickly is your best chance to minimize damage to your heart. A heart attack often begins with a deep, uncomfortable pressure or squeezing sensation in the center or left side of your chest. It may feel like a heavy weight pressing down, or as though your chest is slowly tightening. This sensation might come and go in waves, leading you to think it's not serious. But if it persists for more than a few minutes or keeps returning, don't ignore it. Other symptoms include shortness of breath, even without chest pain. You might feel like you can't catch your breath even while resting. Pain or discomfort may radiate to your arms, often the left, but sometimes both shoulders, neck, jaw, back, or stomach, where it might mimic indigestion. Additional signs include lightheadedness, a cold sweat, nausea, especially common in women, dizziness, or overwhelming fatigue that feels disproportionate to your activity. For some particularly older adults or women, symptoms may be atypical, such as vague pressure in the back or stomach rather than sharp chest pain. Consider the case of Richard, a 74-year-old man who was sitting at his kitchen table when he felt an unusual tightness under his collarbone, similar to heartburn followed by difficulty taking a full breath and sweaty hands. Initially, he thought it was indigestion from his lunch, but he recalled a health seminar warning that heart attack symptoms can be subtle. By acting immediately, he avoided a potentially fatal delay. Similarly, Ellen, a 68-year-old woman, felt mild jaw pain and nausea while gardening alone. She considered fatigue, but remembered a doctor's advice about atypical symptoms in women. Her prompt action saved her life. Your body often gives subtle hints before a heart attack escalates, and these early warnings are your window to act before the situation worsens. To prepare, familiarize yourself with these symptoms and take them seriously, even if they seem minor. Risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, or a family history of heart disease increase your risk, so be extra vigilant if these apply. If you experience chest pressure, shortness of breath, or unusual fatigue, especially in combination, stop what you're doing immediately. Don't brush it off as indigestion or try to tough it out. Keep a mental checklist of symptoms and practice listening to your body. For example, note how indigestion or muscle strain differs from the heavy, persistent pressure of a potential heart attack. Discuss your risk with your doctor during checkups, asking about specific symptoms to watch for and whether you have unique risk factors. Practice distinguishing normal discomfort from potential heart attack signs by reflecting on past sensations. Trust your instincts. Your life may depend on it. Step 2. Calling emergency services. Immediately, once you suspect a heart attack, the next critical step is to call 911 without delay. Do not wait to see if symptoms subside, attempt to drive yourself to the hospital, or worry about overreacting. Calling emergency services is the fastest way to get life-saving help. Every minute during a heart attack counts. Delayed action increases the risk of permanent heart damage or death. When you call 911, trained dispatchers begin coordinating a response, dispatching paramedics with essential equipment like defibrillators, oxygen, and medications to stabilize you. They can monitor your condition en route to the hospital, which is critical if symptoms worsen. Driving yourself is dangerous. You could lose consciousness, cause an accident, or delay critical care. By calling 911, you ensure help comes to you quickly equipped to handle a life-threatening emergency. Take the example of Linda, a 78-year-old woman who felt a strange ache in her left shoulder, nausea, and a cold sweat while alone. She considered calling her son but recalled a nurse's advice. If you're alone and suspect a heart attack, call 911 first, then contact family. She dialed 911 and paramedics arrived as her symptoms intensified, stabilizing her with oxygen and medications. Similarly, Tom, a 67-year-old man, felt chest tightness while reading. He hesitated, worried about bothering emergency services, but called 911 after recalling a friend's heart attack story. That call saved his life. Dispatchers are trained to handle uncertainty and prefer responding to a false alarm over missing a critical case. Keep your phone accessible, especially if you live alone. Many smartphones have an emergency call feature that works from a locked screen. Learn how to use it, e.g. pressing the side button multiple times on an iPhone or using the emergency SOS option on Android. If speaking is difficult due to shortness of breath, stay calm and use this feature. In some areas, texting 911 is an option. Check local availability and save the number. Practice accessing these features and keep your phone charged, especially at night. If you live in a rural area, inform a neighbor after calling 911 to assist if response times are longer. For example, you might text a neighbor to let them know paramedics are coming. The sooner you call, the sooner help arrives, maximizing your survival chances. Step 3. Chewing an aspirin. Slowly and calmly. After calling 911, the next critical action is to chew a standard 325 milligram aspirin if you have one and are not allergic, or on a blood thinner that contraindicates its use, e.g. warfarin or apixaban. Consult your doctor in advance if unsure. Chewing rather than swallowing allows aspirin to enter your bloodstream faster, improving survival odds. Aspirin thins the blood by inhibiting platelet activity, helping to slow or prevent a blood clot, blocking a coronary artery, the main cause of most heart attacks. Studies like those from the American Heart Association show chewing aspirin can restore some blood flow, buying you time until paramedics arrive. Use an uncoated 325 milligram aspirin for the fastest effect. Coated or delayed release versions absorb more slowly, though they're better than nothing if that's all you have. If only low-dose 81 milligrams aspirin is available, it can help but is less effective. Avoid taking aspirin on an empty stomach if possible to minimize stomach irritation. But in a heart attack, clotting risk outweighs this concern. Consider Joe, a 72-year-old man who felt tightness spreading from his chest to his neck one morning. He chewed an aspirin from his kitchen cabinet while waiting for paramedics, a move his cardiologist said likely reduced heart damage. Similarly, Sarah, a 70-year-old woman, kept aspirin in her purse and chewed one when she felt chest pressure and nausea, aiding her survival. Store aspirin in accessible spots, nightstand, kitchen, wallet, or car, and check expiration dates regularly, as expired aspirin may be less effective. Inform loved ones where it's kept. If you have stomach ulcers, bleeding disorders, or aspirin allergies, confirm with your doctor if aspirin is safe and whether you should keep an alternative, like nitroglycerin if prescribed. Consider carrying a small emergency kit with aspirin and a note listing your medications and allergies. For example, a labeled container with a few tablets and your medical details can be a lifesaver. This simple science-backed step is standard in emergency medicine and can mean the difference between recovery and severe harm. Step 4. Sitting or lying down to protect your heart. Once you've called 911 and taken aspirin, minimize heart strain by stopping all physical activity. Sit or lie down in a safe, comfortable position and avoid moving unnecessarily. Pacing, gathering belongings, or trying to push through increases your heart's oxygen demand, which is already compromised. Your heart is struggling to pump blood, and exertion can worsen damage or trigger arrhythmias. The ideal position is sitting upright, with your back supported, feet flat, and arms relaxed, reducing heart effort while keeping you stable. If you feel faint or lightheaded, lie on your side with your head slightly elevated, using a pillow or rolled-up clothing to avoid choking or discomfort. Resist moving even if you feel restless or embarrassed about doing nothing. Staying still conserves energy and oxygen, potentially preventing further damage. Alice, an 81-year-old woman, felt chest pressure and wanted to tidy her kitchen, but recalled her doctor's advice. If you think it's your heart, sit down. Everything else can wait. She sat in her recliner, staying still, which likely prevented cardiac arrest. Similarly, David, a 71-year-old man, felt symptoms while walking his dog and sat on a bench leashing his dog to stay safe. Identify resting spots in your home like a chair or sofa, and keep assistive devices nearby if you have mobility issues. If outdoors, find a safe spot like a bench or step. If in a car, pull over safely, turn on hazard lights and rest. Mentally rehearse resting calmly to act instinctively in a crisis. By staying still and breathing slowly, you give your heart the best chance to stabilize until help arrives. Step 5. Unlocking your door for emergency responders. If you have strength after calling 911 and resting, unlock your front door to allow paramedics quick access. This small action can save critical seconds, as a locked door may force responders to break in, delaying treatment. Every second matters when your heart is struggling. If you live in an apartment or gated community, ensure your address is visible and consider a spare key in a lockbox or with a neighbor. A smart lock with a code can help share it with 911 dispatchers. Paul, a 76-year-old in a condo, felt symptoms, called 911, chewed aspirin, and unlocked his door. Paramedics said this saved 30 seconds, crucial as his condition worsened. Similarly, Maria, a 73-year-old, used a lockbox code to ensure access. If walking to the door feels risky, prioritize staying still. Prepare by keeping a spare key accessible and informing dispatchers of its location. Stay on the ground floor if possible. In rural areas, leave a porch light on or use a reflective marker to guide paramedics. These steps ensure faster access, improving survival odds. Step 6. Using your phone's speaker or medical ID features. Your phone is a lifeline during a heart attack. Switch to speakerphone when speaking with 911 to keep hands free and reduce strain. This helps you focus on breathing while dispatchers hear you clearly, detecting changes in your voice or breathing. Set up your phone's medical ID feature on iPhones or Androids to store your age, allergies, medications, and emergency contacts accessible from a locked screen. If you lose consciousness, paramedics can use this data. Susan, a 79-year-old, fainted before paramedics arrived, but her medical ID showed her diabetes and penicillin allergy, preventing harmful treatment. Practice accessing your phone's SOS or medical ID features. Some phones share your location with 911. Automatically test this in advance. In areas with text to 911, save the number. Keep your phone charged and nearby, especially at night. If you use a smartwatch, enable heart rate or fall detection features. These tools ensure critical information is available when you can't communicate. Step 7. Slowing your breath to steady your heart. Panic is natural during a heart attack, but can worsen your condition by raising your heart rate. Controlled breathing calms your nervous system and reduces heart strain. Inhale through your nose for 4 seconds, hold briefly, and exhale through your mouth for 6 seconds. Repeat, focusing on the rhythm. This won't cure the heart attack, but can prevent stress-induced arrhythmias and maintain oxygen flow. Frank, an 83-year-old, felt chest pain and fear, but used a breathing exercise from his doctor. Slow breaths kept his heart stable until help arrived. Practice this during calm moments, like while relaxing, so it's instinctive. Use a smartwatch to monitor your pulse during practice. Other techniques like visualizing a peaceful scene or repeating "help is coming" can help. If you have anxiety, work with a therapist on coping strategies. This small act of control can buy critical time. Final thoughts. Surviving a heart attack alone isn't just luck, it's preparation and action. These 7 steps: recognizing symptoms, calling 911, chewing aspirin, resting, unlocking your door, using phone features, and controlling breathing, form a powerful strategy to maximize survival. Prepare now, store aspirin, set up your medical ID, ensure door access, and practice breathing. Share this with loved ones, it could save them too. Act fast, stay calm, and give yourself the best chance to survive.